My name is like the full name.
Oh yeah, you're so professional. Hi everybody, welcome to COVID Convos. We are all here today, and we're all here to talk about what's going on in the world and also to complain about the weather. And although maybe not, maybe I'm the only one who's here to complain about the weather. It's hard to say, but yeah, we're here and it's Tuesday. And it's nice to see everybody. And I think just a couple of things. One, we're all here today, so it would be a good day for any questions or comments or anything like that. We'd love to chat with you as well. So you can pop your comments in the just in the comment section, and then Jude does some kind of millennial technology situation that rolls them across the bottom of the screen for everyone. So I call it magic. Other people call it technology. Whatever works. And we're here to answer all of the questions and talk about all of the things. We haven't all been together in a while, and things are shifting, and I'd love to hear about where people are at. So should we just get started? You guys want to introduce yourselves? How are you? I know we're not supposed to ask, how are you? But I'm actually kind of curious. So you can pass that question if you want. If you're like, I don't want to talk about how I am. But if you feel like telling us, that'd be great. Otherwise, maybe you could tell us about, I don't know, one thing that keeps you warm. Okay, off to the races. Who wants to start?
Hi, I'm Levi. I'm starting today, so I don't get shamed. I'm really excited to see everyone tonight. This is really nice. I'm the ED over here at Sunshine House, and so we got Jude on the back end, as Maggie said, who's kind of handling all the magic. It's nice to see everyone take some time out, and I was on vacation last week, and that was really enjoyable for the most part. I mostly got vacation, so it was great. Our van got broken into twice, but Rowan's really good and kind of handled that, and so the window's cardboarded up now, and we're good to go. We're good to go. And things that are keeping me warm during the pandemic or during this cold snap, I guess my disdain and general hatred for the world.
I mean, if it keeps you warm, I say go for it. Who's next? Thanks, Levi.
I love that answer. I can go next.
Thanks, Marsha.
So I'm Marsha. I am a public health doctor. Doing okay. It's a long day, right? Work, and then the kids have to be bathed and fed and kind of semi put to bed. So I'm also tired now. And in terms of what is keeping me warm, in addition to Levi's answer, I build a lot of fires in the fireplace. So quite literally, that keeps me warm.
Awesome. Thanks, Marsha. What about you, Karen or Uzoma?
My name is Karen, and I am just joking, because you said Karen or Uzoma. I was like, oh, who do I want to be? Too bad I put my name there. Okay. Yeah, I'm Uzoma. I'm a nurse. I'm an MLA. I'm a politician. I represent the constituency for the province of Manitoba called Union Station, which is kind of the core of downtown Winnipeg. Levi is one of my most favorite constituents ever. Sends me a lot of hate mail, but that's fine. Just joking. Levi's never done that. Never. And don't start, please. Yeah, things are okay. It's been very, very cold, but I've kind of committed a couple of months ago to, as much as I can manage it, to get outside, even if it's for a few minutes a day, just get some sun and get some fresh air. And so even though it's been minus a million, I've still gone out for a ski, which has been very short, very brief, but it's still nice to get out and feel like I'm getting some fresh, freezing air into my lungs. So trying to find ways to manage just like everybody else.
Uzoma, are you skiing? Are you a regular cross-country skier, or are you a pandemic happened, I guess I'm going to put skis on? Is it a thing you've done?
It's something that I tried out a few years ago because the winter months are historically a bit challenging for me. Like many people, we don't, the days are shorter, and I found that my mood was, kind of impacted during the winter months. So trying to figure out ways to get outside and not have a negative relationship with winter. And cross country skiing was like the safest, most low impact thing I could do for my body.
Mhm.
And even now, like I hurt my ankle actually really badly a couple of weeks ago trying to go down a hill. I don't know who I think I am. And I'm still able to at least get out on skis and just go straight forward, like I can do that, and my ankle feels pretty secure. So it's just a thing that I'm like, now we're in this pandemic, I might as well pick it up again and get my body moving and do some good stuff for my mind. And it's helping. So
That's awesome.
yeah.
I love this. My ex's mom is a cross country skier, and she lives out in the country, and she buries bottles of booze every kilometer and puts a little bench on her track. So like it takes her forever to go through her cross country ski trail because she's doing like 4 shots. She has like a Jaeger stop
That's
and a Bailey stop. Anyway.
Wow.
I feel like that is leveling up. Put that,
Yeah, that's
anyway.
amazing.
All right, Karen, how about you?
Hi, I'm Karen, and I work in human rights during the day, and during the evening I quilt, which they coincidentally also keep me warm. But what actually keeps me warm right now is this ring light that I'm testing out for the first time, which I also think is why none of my technology was working initially and I delayed the broadcast. But this ring light, which I was inspired by Marcia to invest in, because Marcia always looks so good during these COVID convos. Mm-hmm. And part of it is just Marcia, but I thought maybe I could borrow some of that glow with the ring light situation. So that's what's keeping me warm, and I'm glad to be back and to see everybody. This has kept me warm all pandemic, but in particular on this cold night.
Oh my gosh, I love a ring light, you guys. They're really the best. I've really enjoyed mine, and it's at the studio, so I'm not even set up with it today. And trying to like work my lighting so I'm not in a shadow is hard work now that I'm like spoiled by the ring light. Anyways,
Can we just quickly talk about that shade Karen just threw at Marcia? Part of it's I was like, no one's gonna talk about that shade.
I was only choosing to hear the part that was the glowing review.
Okay, it's all Marcia. Oh my god, I can't believe I said that. And Usama.
I know what you meant, but I had to. So Marcia said it. Everybody knows it, but that was just.
Oh my god, you guys!
It's
the ring light
11. It's month 11 of the pandemic, and we're starting to turn on each other. So that's where things are at.
I mean, it's been a year. That's pretty good, actually. We're not doing too bad, everyone. Oh my gosh. All right. And I'm Margaret. I'm a nurse too. And I work in harm reduction, drugs and sex, both personally and professionally. And I'm really excited to be here. Things that have been keeping me warm. Honestly, I don't know if you guys are following Karen's quilting Instagram, but like that post you did, like introducing yourself to your followers, Karen, I was like, I loved it. And then all of the pictures of all of the different fabrics and textiles, like I was like very here for it. And then the other thing that I saw recently on the internet was Uzoma doing a like, I love to read video. Like somebody posted, you know what I'm talking, like you were reading to the children and it was it was sweet. And like that shit really does actually totally warm my heart. And I was thinking about you and I was like, it takes a lot of energy to do the work that you do and to like be queer in the world of politics, etc. And then also to then still have like that like sweet energy to put into kids. I was just like, anyways, it was good. So thanks for posting both of those things, you guys. It was really good. And yeah, so maybe should we actually just hear what the hell's going on to start? Marsha, will you start us off, and then we can see where we're at?
Okay. So I just pulled up the latest numbers for the province. And so new case numbers have been down. There were 75 new cases today, over 30,000 in total now. The total number of people in the hospital is still 266. So that hasn't come down as fast as we thought it would. So still putting quite a bit of strain on the healthcare system. If you look on the website, it says 104 active hospitalizations. That refers to the number of people who are in that, acute 10-day infectious period. And so that's why there's two different numbers on the government website there. ICU numbers, 15 that they call active and 33 in total. Test positivity has come down nicely overall. It's at 5.4% in the province. With things getting better in the province in general, things also getting better for First Nations in terms of our numbers. Today, there were 24 new cases in First Nations people. That was about 30% of all new cases in the province. The test positivity still is higher. It's at 11% overall, so just over double what it is for the province. And hospitalizations and ICU still make up 40 to 50% in the province. So improved overall, but those gaps are persisting, which is not a real surprise to anybody. I think, the other new thing that was reported today was the first case of the UK COVID variant has been reported in Manitoba. And so I think the presence of the variants, is raising a lot of questions and concern in terms of if they start spreading in the community, how is that going to impact our cases and our numbers? Certainly, we've seen some new restrictions in place in terms of the federal measures with international travelers needing to quarantine and be tested. Similarly, people returning to Manitoba from anywhere now need to self-isolate for 14 days. Those stricter measures are to try to slow the spread of the variants and make sure that we can detect them and isolate people so that they're not spreading wider. I would say one of my general concerns would be if you have a variant that's more transmissible, how that's going to act in overcrowded, inadequate housing settings like First Nations communities, like low-income racialized neighborhoods. So some good news in terms of lower numbers overall, but certainly still some reasons to be concerned. And yeah, that new variant's now here.
Can we talk about that? Can you explain that a little bit for folks? Just what is it, and why are people concerned, or why are people sort of paying attention to it, if you will?
Mm-hmm. So, there are 3 variants that we're hearing about in the news. They're generally referred to by the country that they're first detected in. So we'll talk about the variant from the UK, from South Africa, and from Brazil. So the way that I would think about it is we need to get a different flu shot every year. And part of the reason we need to get a different flu shot every year is the influenza virus mutates. And when there's enough genetic shift in those mutations, then our body's immune system is not going to recognize it based on our previous infections or previous flu shots. And so the coronavirus also is going to shift and mutate over time. That's not a big surprise. And so that is what these new variants are. They are still coronaviruses, they're still COVID-19, but there's been enough shift in the kind of genetic pattern of it that it's behaving a bit differently. And I think one of the concerns is that we're not sure how much immune response there's going to be to the new variants, even for people who've been previously infected. And then, of course, what everyone is really paying attention to is how easily are they going to spread, and the early evidence that they spread more easily. And then also, are they going to cause more severe illness or not? And some early evidence, I think, particularly for the Brazil variant, that it might actually be more severe as well. So those are the kind of variants we're watching. Because they might act differently when they enter our population and might shift how we need to respond from a health system and from a public health perspective.
And then what about, so I feel like the other thing that people are asking questions about is just around vaccines. And so, and like what happened, like do the vaccines that we have work? Is it as big of a job to try and figure out a vaccine that will respond to a variant than it is to build a whole brand new one? Like what is the story around that?
Yeah, so again, this is all very new, but so far it looks like both Moderna and Pfizer will work against the new variants in general. Moderna published a study saying that there's somewhat less antibody reaction against the South Africa variant, but they still expect the vaccine is going to work overall. And that most importantly, it's still going to reduce severe illness for people who do become infected. So that's important. People might remember that with the influenza vaccine, it's actually not super great at preventing influenza infections, but it certainly does decrease the number of people who have to be hospitalized or who pass away from influenza. And so with South Africa variant, the Moderna vaccine looks like even if it's somewhat less effective at preventing all illness, will still prevent the most severe illness. People might have also seen that the AstraZeneca vaccine, which is not yet approved in Canada, has actually been pulled in South Africa for further studies because it does not look as effective against that variant. And so that might impact our planning down the road. The main thing that I would want people to know, though, is it does look like both Pfizer and Moderna are going to continue to offer protection against those emerging variants. But even partial protection against those variants, and then the 94 to 95% protection against, the widely circulating strain is still going to be really effective overall and beneficial for people.
Anyone else do you guys feel like we know so much more about like vaccines and public health than we ever thought we would? Like, I don't know. I feel like the amount of information that we're getting is like just a lot, and trying to wade through it. Holy heck, there's a lot out there. Any other thoughts from the rest of the folks there?
I think the one
today
that comes to mind is that Karen definitely had a thought, and I want Karen to hear Karen's thoughts on that. So.
It's unrelated to vaccines, so go ahead.
Mine wasn't actually technically related to vaccines either. Go ahead and say, you got this, Karen.
I was just going to ask, Marcia, today was a big day in terms of COVID announcements, not only the presence of the COVID variant, the UK variant in Manitoba, but also an announcement with respect to a further loosening of restrictions. And I wondered if you wanted to talk a little bit about that. And I'm sure folks have questions about the presence of a variant and the loosening of restrictions and what all of that means, for public health right now.
Okay, so I read this story as well. Haven't seen the full detailed list, but I think the key highlights are some more things are opening up. What's not changing, from what I gather, is the number of people who can come over to your house. So that's sticking to 2. Weddings gathering sizes are going up to 10. Places of worship are opening up to 10% or 50 people. Nail salons, some other services opening up, again with strict occupancy limits. Restaurants are opening, but apparently you're only allowed to eat with the people in your household. I have to say I'm really disappointed by that. I eat with my kids all the damn time. I was really hoping to be able to go out with some friends for a meal. That is apparently a no-go at this time. Some other services like gyms are going to be able to open, but only for one-on-one instruction. And then some other things like museums opening up as well. So I think, it's hard not to open things up more when numbers are down. It was always complicated, but it is getting more complicated with the variants entering the country and now Manitoba as well to find the right balance point. Personally, I do think it's a good idea for us to open things up a bit more. I think there's a lot of unintended impacts of the tight restrictions that people are feeling and experiencing. a lot of people, you know, in the service industry, lots of small businesses that have been having difficult times. I was talking to my physiotherapist today about the impacts on some of them, but I think we need to be still really cautious. And even if we are going out a bit more and, you know, going to some other facilities, gyms, museums, places of worship, we need to be really cautious still in terms of limiting our non-household close contacts.
Sorry, I said thanks, Marsha, and then I said, Uzoma, do you want to kick in?
No, I mean, yes, I guess I do. So, you know, folks really, I know that folks are struggling. I think that, you know, it's hard for all of us actually. We've been in this now for quite some time, almost a year, and it's challenging, and we're going to be in this for many months to come. That's just the reality of it, and it's a tough reality. One of the things that I really want to continue to encourage folks to do is just like the stuff we can control. You know, there's so much we can control. We got the news of the variant today, and you know, I heard from a number of folks sending me emails asking what this means and asking like, how can we loosen things when there's this new variant? Like that just seems ridiculous. And I encourage people to just continue to focus on what we can do within our own capacity. And those fundamentals are still incredibly important. You know, there are things that I think a lot of people now, and I see friends who have like really, really little kids, and how their little ones, to them, the fundamentals will be with them the rest of their life. You know, like these are things that it's almost, you know, like a mantra at this point. It's just going to become the thing, right? Socially, well, maintaining some space, maybe even down the road, physically, we're washing our hands all the time, all of these things. But I think when people feel overwhelmed, and I know that a lot of folks are feeling overwhelmed, you know, especially here where we're still now in this frigid months and it's really freaking cold right now, just focusing on what we can do and what we do know is really, really important. And the information is going to continue to change. That's just the nature of this kind of a virus and the situation that we're in. And listen to people who know the science. I love this because I love hearing from Marsha. I love hearing from experts who are reading the papers and the research that I'm not reading. And you know that, you know, for whatever reason, we're not the folks going on YouTube and clipping like 1 little minute things that people are sending me saying, have you seen this though? You know, conspiracy theories and whatnot. So I think just focusing on what we can do, what we can control, and listening to the people we trust, who we know are doing the heavy lifting to understand this stuff, is really important.
Thanks, Uzoma. Yeah, it is. It's a lot of information and it's a lot of overwhelm. And I can appreciate, and right now, especially, I feel like it is a really tough, like it's hard. It's just hard. And so wondering about how like the folks that you guys are connecting to are sort of responding to all of this and what the feeling or sense of things are.
As I kind of touched on already, I'm hearing a lot from folks who, like, it's very mixed actually. I hear from folks who want things to be, I want all the restrictions loosened. Like, what are we doing? This is ridiculous. Like, you know, consistently I've heard from a handful of those folks, not very many, but consistently there's a few. You know, many folks who are confused, right? Like it's the overwhelmed feeling seems to be really amplified right now. And navigating what even the loosening of restrictions at 25% means for a lot of places. It's not something that, unfortunately, for a lot of folks, it's not a percentage that is going to be significant enough that it's going to alleviate a lot of the burdens that they've been dealing with, especially small business owners. So, you know, I think that the big thing that I'm hearing from folks is just wanting that increased communication. You know, who do we go to make sure that if I've got questions or concerns, I can get answers and feedback really quickly? And I completely appreciate where that's coming from. I don't know if it's like that for you folks, but I'm mostly just hearing from people generally. They just want more information and more consistency of access to information.
Well, and I think our rationale,
Yeah.
like I think it's I think some of the stuff, Marcia, that you've talked about around like what is the point of public health and how important it is to actually have those restrictions in place when needed, but not continue them past the point of necessity is really like an important conversation. And also the piece that you constantly mention about unintended consequences around public health orders, like what happens, what is the other stuff that we're not tending to. And so like that is, I just wish that our leaders would talk more in that way, because I do think like I have certainly shifted my perspective from being like much more leaning towards like shut it down, let's deal with this like infection, to like coming a little bit closer to like thinking about things in the way that Marsha's kind of presented it around like how do we actually find like a balance that allows us to not like have all these unintended harms happen, but also, and that those nuances get pulled out of press releases and they get pulled out of press conferences because somehow people think that we can't handle the information, or we can't it's like that friggin' that, I don't know. Anyways, so that piece I think is really missing a lot, that because we are Manitobans are perfectly capable of listening and making decisions based on what we are told, and I wish that was more what we were hearing. Anyway, what about you guys, Karen and Levi? How's everybody on your end?
Well, I think I think about it from the perspective of people who work in the service industry that I know who are really anxious about, on the same day, both learning about a loosening of restrictions and potentially having more, contacts with individuals at the same time as hearing that there's a risk of greater transmissibility of COVID-19 in community. So I think it's, that's sitting with folks in a way that feels challenging and difficult and leaves a lot of us to have to make personal decisions about how to keep ourselves and our families and communities safe in the context of, of recognizing the need for that balance that Marcia was talking about. And I think Marcia mentioned it early on about the variant and what this means for overcrowded housing conditions and what this means for essential workers or workers who are in, conditions where they can't safely physically distance. And I think in a lot of those instances, you'll find an overrepresentation of BIPOC folks or folks that experience other forms of structural disadvantage. And so thinking about the way in which potential increased risk might impact our communities disproportionately in the ways that we likely have already seen just based on the data from other jurisdictions. Was a bit of a tough day in terms of figuring out how to make sense of all of the information that we were getting and all of the ways that you understand the need for people to be able to access services on a greater basis for their mental health, for their community well-being, for their family well-being. But then at the same time, recognizing that means we are, placing some communities at greater risk by doing that, and who is being asked to bear that risk. And so those are some questions that I've been left with, at least today, based on the press conference that I watched. I watched those press conferences religiously, but I watched the press conference today and was left with those questions for sure.
Yeah, well, we don't actually create the conditions in which opening up the ways that people want to could be safer, and I think that's a fair question to be like, yeah, like all of the points, like we need people to be able to work, we need people to be able to like support their families, and also what are we doing systemically to actually address the like increased risks that people are being asked to take, and how, like, which of course is not happening. So yeah, fair enough. It's such a tricky moment in time. What about you guys, Levi? How's it going over at Sunshine House?
I didn't actually know this was happening tonight. I was just here for the Karen and Uzoma constant bickering. So I brought a ribbon and I was just sitting here playing and I'm waiting for some more entertainment to break out.
We're like, it's a whole day in February. We're going to be super fucking serious the whole time.
Somebody else's hatred could warm me up for once. Come on now. I think right now what we're seeing is that COVID doesn't exist. Like it's not an actual thing that people are concerned about given the reality of what people face when they open the door. So COVID, for so many of the people who utilize the space, COVID is an afterthought. It's not a primary concern. One of the things that we know is like it is a primary concern for a lot of people, but you have to also those unintended consequences of prioritizing one thing over the other can be actually life altering or can potentially cause extreme harm or death. So you have to determine which one puts what's your greatest risk for the day. So if surviving for the day means that you might have to just go and stay in an overcrowded situation, or you might have to go and sleep in a place that you're extremely uncomfortable in, and that might put you at greater risk for other forms of violence. Thinking about COVID is not a thing that is actually healthy to do. Like you can't add that additional stress and that additional anxiety onto many people's day-to-day life altering decisions they have to make in this kind of environment. I think the other thing that we've noticed is that the systems in place, particularly around the CERB clawbacks and the coming back onto people who had claimed CERB when there was some uncertainty around that, we've seen some extremely negative impacts from different systems such as EIA in this province, who have cut people off, which has led to increased houselessness, but not just for the individual. So that individual might be sharing an apartment with 2 or 3 of their relatives, and then when they got kicked off, or when there was a suspected claim, like there's not even any evidence. There was just a suspected case that they might have claimed CERB, and that person, we know that in one particular instance, people were like 4 or 5 people were evicted from a place because they had no EIA and there was no way to contact their worker. So when we're people are navigating all of these things all at once. So COVID isn't a thing that you can dedicate a lot of time or energy to. And then of course, we're also seeing that people who do have situations, we're seeing a lot of, like somebody called me today and they were like, well, are you seeing an increase in numbers? And I was like, no, we actually don't ever see an increase in number when there's cold weather. And that's the concerning part, because people have to stay closer to kind of the Main Street unit or the other units if they need to get into a shelter that night. So they're not going to venture too far from those places in the event that they might lose their space in either Silent Home or Main Street Project, or just that kind of being able to come up with a group solution if that is the case. So that's also really, really concerning. And we've had in the past, we've had members of our community at Sunshine House who have died from exposure and who have died in these types of situations. So that's always really, really concerning for us. And so I think this year in particular, we've been at least part of conversations that we weren't privy to in the past. And so now there's a lot of people are doing a lot of work in communicating information to us about what's available and what's open. And there's a lot of collaboration that we at Sunshine House, maybe other organizations had a different experience, that we're privy to. That's very, very helpful in helping us navigate this environment, but also very helpful for us to be able to assist people who are encountering the situations. Like last night at 8 p.m. where there was 3 of us, and we're all figured out a plan for 3 people that night who needed a place to go, right? And so so that's kind of what we're seeing right now. Like, and again, this is all, I think, community interactions change on a week by week basis. So when the weather is nice, that we can have more conversations about COVID or about vaccines or about all these things. But that's just, people are agitated, they're angry, they're frustrated, they're upset, and they have every single reason to be, because it's very, very hard. And so we're not in our same kind of naggy auntie, put your mask on kind of place this week, because that's just, you're just opening up opportunity for people to just lash out, because it's a very, very tough place to be. Luckily, this coincided when we're seeing, at least in Winnipeg, this is coinciding with seeing a decline in numbers. So that makes the tension from our end a little bit easier to navigate. We can do it with a little bit more ease, knowing that there's not a very high viral load present potentially in the space. But it's still really, really hard. And I commend everyone out there who's doing their friggin' damnedest to ensure that community members are safe. And that starts from the community members themselves, who are doing most of that work themselves. And we work with the folks who are able to just kind of do it all.
Anybody else? Levi, this is the conversation that I'm having too with folks constantly, and thinking about, thinking about how do we do this, even if we're not, even when we're not thinking about, even if we are thinking COVID prevention, but how do we actually not impose that onto people and folks that we care about, who are actually, where it's very low down on the list of things that we need to be thinking about right in this moment. And especially in this freaking weather, making sure people have somewhere to stay is more urgent than, whether or not somebody is at risk for potentially an infection in 2 weeks, right? We need people to be able to kind of stay alive right now through this really hard weather moment in time. Anyway,
yeah, it's what it looks like when you have to, when you're making decisions in the context of overlapping and intersecting pandemics, right? Yeah. That you have to start weighing risk in really unfair and troubling ways, for clients, for community, for staff, for relatives. That's a very challenging thing. And it was so insightful when you and Adrian were speaking last week or 2 weeks ago. And thanks again for raising it in the context of our current weather, Levi.
It's interesting. What comes to mind is, it's over the last few weeks, there's been a lot of folks, a lot of debate or frustration around people who've taken off, people in leadership positions who've taken off for warm vacations, or working from hot places and what have you. And that kind of comes to mind for me right now when I think about privilege, and when I think about responsibility, and the ways in which some people have to fight tooth and nail to keep themselves alive, and how difficult it is to focus on, you can't think of, Levi very, very, eloquently said, how can folks even think about COVID, right? It's just not in the realm of possibility when you're trying to figure out on an hour-to-hour basis how you're going to survive. And, I think it's something that really we need to be able to reflect on, the where we invest our resources, and who we are investing in, who we're investing our resources into. I think that it's being reflective is important, and sort of evaluating that is really important. But as we see the impacts of this kind of really dangerous weather that we're navigating right now, and some people are faced with right now, and we see the outcomes of people, dying as a result of being unsheltered, and as a result of constructing circumstances where folks can be unsheltered. Really, I think it's really important for us to be able to sort of action that reflection. And it's wonderful to see folks in community and organizations come up with creative solutions to meet the needs of folks who are underserved in our communities. But I certainly, I hope that, as we move forward and we look at different ways that we can action, how we reflect on certain decisions that people make, that we really raise the standard and raise our expectations of people and demand better, to ensure that, we're investing in people and in places that mitigate those harms. It seems a little silly to be, seeing some headlines around, like I said, people taking off to warm places when we have, community members who are dying because we allow them to be unsheltered. That's unacceptable. And I commend the folks who continue to step up and make sure that, our community members are having their needs met. But I really want to see some more concrete action taken in terms of investing in ways to mitigate those harms. This pandemic sucks, but I would really like for people to be able to, think about COVID in a way that allows them to navigate it as safely as possible because their other needs are actually being met, as messed up as that might sound. It's sad to me that this is a reality that we're seeing and that we're talking about when there's absolutely no good reason for it at all. So those are just my thoughts. It's kind of been weighing pretty heavily, over the last couple of weeks, seeing what's going on, obviously the last couple of days with folks who passed away. But I hope that we can, continue to raise our voices and figure out ways to move forward in a way that really keeps people safe and needs met.
Well, and I think that makes sense, Uzoma. The truth is, there's a lot of things, COVID is one piece of the pie, but the ways that we have responded have not been adequate. And I think, had we been able to adequately respond to the things that Karen's talking about, to the issues that are around overcrowding, and to all of the, to people who are in Winnipeg, in Manitoba, in the winter without a place to be, those are all things actually that are well within our power to shift, and also it's not even just I don't feel like that is a far away, well within our power. We have seen how we have responded quickly to things that that have felt like they matter, and this matters. And so I think it's actually a very reasonable thing to be we could be, think about how well we could be managing COVID, and if we were actually tending to the things that that Adrienne talks about, that Levi talks about, that Karen is talking about, that that we're all talking about, it would look different. We would not we would feel differently. We would be this disease is shitty, and also we're doing the very best that we can. That's how I want to feel all the time. I want to feel we are all collectively doing the very best that we can. And I think that's very fair.
Well, and something else that Karen said, it's interesting because Karen, you hear from folks in the service industry and their concerns around what it means to, go back to work in certain ways and to come into potential contact with this new variant, and all of those very valid concerns. And I think back to the very beginning of this pandemic and folks in the service industry that I was talking to, that I was hearing from, and their concerns and their fears. And I'm how are we?
Oh, you're muted. Uzoma, you're muted.
Sorry, was I
vehemently muting? Sorry. She's also pissed off.
Sorry. Was I muted the whole time?
No, not the whole time. You were at the part where you were the people that I was talking to back then, and then you were about to get vehement. Hang on.
I think we're this far into the pandemic, and folks in the industry are still having those concerns. Those are the same concerns that we were hearing, that I was hearing from at the very beginning, and it's just, it just highlights again, for all of the ways that we talk about unintended consequences of restrictions and all of that, we have to be able to talk about the ways in which we protect people and who we protect. And when I look at other jurisdictions that have very, very low COVID numbers, have little to no restrictions at this point, their priorities were different, and how they action protecting people was different. And so it's frustrating to hear these concerns at this point, concerns that are very valid, and to see that we continue to not invest in protecting people in ways that we are fully capable of doing so. We're not going to see the outcomes that we want, and we're not going to come through this pandemic in a manner that has people being as okay as possible if we don't make those decisions. And so it makes me, a little sad for those folks who have navigated those reactions and those concerns now for, a year. We can and we should do better. But I certainly hope that, as we move forward in the next few weeks, I know folks are going to continue to do the best that they can, because they are, and they've, brought those numbers down. But I certainly hope that we've learned from some of the historical mistakes, and we see some different decision making to protect the people who are consistently most at risk.
Yeah, same. What about the rest of you guys? Does anyone else want to weigh in before we wrap up tonight?
Or I'll just answer Michelle's question. We will once we don't have broken windows in the van. When we have windows in the van, we'll drive it around, but we have broken windows in the van, so we can't really drive it around safely.
When the cardboard windows are gone, you'll
Yeah.
go back to business as usual. Yeah.
We'll see what happens.
I mean, and I think it's those kinds of and Michelle, I appreciate this kind of question and the ways in which we do we can make choices to do what we can when we can, and I think that's the stuff those are the things why I love hearing about your mom making you sewing for you, Karen, and listening to Zoma talk about the kids and listen to the kids learning to read and all of that stuff. It is those little tiny moments I've become more and more grateful for this past year, and also thinking about how we're going to do this for a long ass time actually, and what that really there's figuring some of those pieces out is complicated, and also thinking about how we can do what we can and keep talking. I actually think this, we've seen things shift because of public pressure and because of the work that people are doing internally. And not enough, but I remember, I just think even just in terms of harm reduction stuff in Manitoba, and I will be the first person to constantly be we are behind the 8 ball like bananas, but also it's not 10 years ago. Levi, do you remember? There was nothing, nobody was doing. So anyway, I just think I just really appreciate the work that you all are doing, and I am always happy to do whatever it takes to help push it along, because it's a big job, and also it's so valuable. I just appreciate you guys so much and all the shit you do in the middle of this fucking nightmare. And we have 5 minutes left, and Levi's eating ribbon, so I feel we should probably.
Well, you're talking about emotions.
I know. Did it get too feelingsy? What was
yeah.
that meme that you guys sent me today? It was Marsha sent a meme to me today that was perfect. It was basically Levi's intro, if we're going to be real about it. I can't remember. It was something if you trust somebody who is, what is, Marsha, help me, please. Marsha's it's too much. I can't actually tell people on the thread.
Yeah, that was sent to a small group of people for a reason.
Levi,
do you have
it? Fine. If you see me mysteriously post a meme that doesn't seem super about me, you'll all know where it came from.
That's amazing.
What else is going on for folks? Anything? What are you doing this week? Anything? What's new? You guys do shit? I don't do anything, so I'm interested to know. Like, are we all just at home kind of and then working? Is that the deal?
It is absolute chaos at Sunshine House because we're doing that friggin' telethon.
Telethon? Oh my God, I'm dead. I saw that thing and I was like, are you kidding me? A telethon? And then I was like, of course. Of course.
So poor Feather and Jude, for real. I'm sending them my deepest sympathies as for being a terrible boss and supervisor, because I'm like, do all these things and film them and then edit them. And by the way, we have to do all of this in a 2-week period. But not only that, on top of that, we did a bingo not too long ago. We're doing Read by Queens in a couple of weeks. And then I was just like, oh yeah, here's all the tasks. I'm out for a week. So no, this week is absolutely this next 3 weeks are just going to be bananas for us, and it's going to be actually nice because in the dead of winter, being that busy allows us to just like get our mind off of the other things.
Like, Levi, do the kids even know what a telethon is anymore?
I don't.
I was like, I love it, but I'm old enough to remember the like.
Yeah,
like,
I remember
calling
that.
No.
strangers.
Somebody doesn't. Yeah, and people don't know. Wow, how would they know?
How would they know? So just for the young people listening in, I'm sure there's many of you. We used to donate our money not through GoFundMe's or like Venmo or Cash App or eTransfer. We used to call a stranger who was being filmed, who would answer a rotary phone, and you could kind of see them like talk to you as you talk to them, and then you'd give them your credit card number over the phone, and then that money would go somewhere.
Wild. I can't believe that. That's wild that happened.
Anyway, that's what these guys are doing. These guys are doing.
And
Incredible.
And you could also call them and tell them you're going to mail them a check.
Totally. And sometimes we just call to be like, good job. I'm like, we didn't know what was going to happen. It's random calls.
Hi, my name is Levi. I'm calling from Winnipeg, and I'm going to be sending you a $25 check. Thank you so much, PBS in North Dakota.
Well, and yesterday I was listening to drag queens get Venmo'd like 69 cents donations by their fans, and I was like, this is the telethon of today.
Wow. Fascinating.
Anything else? Does anyone want to take this home besides my bad puppy who can't stop barking?
Watch the video of the man.
Hold on.
The lawyer who's got the cat filter. Have you seen that? Listen, I sent that video. I saw it on Twitter. I sent it to my friend Sane. Sane and we laughed too hard. There's a video of a lawyer. I think there's a judge and two lawyers. And one of the lawyers one of the lawyers has a cat filter on his face. And it's perfect. He's like, the judge is like, I think you have a filter. He's like, I know. We're trying to figure it out. And he can't figure out how to get rid of his cat filter. He looks like a cat, a white cat. And then he's like, then he reassures the judge. He's like, but I'm not a cat. The judge is like, yeah, I gathered that. Find it on Twitter. I'm gonna send it to.
They put it. It's in the post, Uzomas. I feel like Jenny posted it. So if you guys want to check that out, it's in the comments. And then why don't you guys watch the girl on TikTok who sleepwalks? If anyone's seen her, it's Lady who sleepwalks. She like sleepwalks and is like, and has like tapes a phone to her so that she can, like, wherever she goes, she has access to a phone. And there is a hotel one where she's naked and has sleptwalk outside of her suite, and she's on the phone being like, guys, I've been sleepwalking. I know. Anyways, it's somewhere on TikTok. I've seen, like, my brother sent me a couple of them, and I was like amused enough to watch through, But anyway.
Okay.
Anybody else want to add any other random shit that we should all be checking out on the internet besides the secret memes? All right, I think we can wrap it up then. Thanks everybody for joining us today and for chatting with us. We appreciate all the comments in the chat, and we're happy to see you all virtually, and we hope to see you again. Take care and stay warm and smash the state or what have you, however you do it best. And we'll talk to you later. Bye everyone.